Welcome to Edds Cosmetic Surgery. Our new clinic facility was built to provide the ultimate in efficiency and safety for our patients. As you enter our center, you will note that all details have been designed with soothing colors and comfortable furnishings. Our patient-friendly staff greets all patients with one goal in mind: your comfort.
I'm Stevie. It's nice to meet you. Welcome to our practice.
You will find our consultation room to be very comfortable and soothing. We believe in giving each patient as much time as they wish to ensure that all questions are answered and that they are totally comfortable with the information they have received. Our skincare section is equipped with the most up-to-date, state-of-the-art laser and skincare systems to treat virtually all areas of concern, including tattoo removal, hair removal, wrinkle removal, brown spot removal, and many other issues. For minor procedures which can be performed under local anesthesia with minimal oral sedation, our fully equipped minor surgery suite is a cost-effective, efficient alternative to using our accredited surgery center. On the day of surgery, our patients are admitted to our holding room where IVs are started, preoperative medications are given, and a certified anesthesia provider evaluates each patient, and we plan and mark for each procedure. Family members are present until patients are taken to the surgery suite. Our state-of-the-art surgery suite is equipped with the same equipment and monitors found in any modern hospital or surgery center. Anesthesia is administered only by certified anesthesia providers. Highly experienced operating room nurses and certified surgical technologists assist with each procedure. Following the completion of the procedure, patients are taken to the recovery room where an experienced nurse monitors them until recovery from anesthesia is complete. Usually within an hour or so after the completion of a procedure, patients are allowed to leave with their family members. As you can see, our facility is designed with the utmost in patient safety and comfort in mind. We think you will understand why we are the busiest cosmetic surgical practice in the tri-state and look forward to working with you to address your concerns. Hello, I'm Dr. Edds. I want to welcome you to my practice, Edds Cosmetic Surgery. The purpose of this video really is twofold. Number one, it's educational. It's my goal that by the end of the time you're here with us today, that every one of your questions is answered, but that you are extremely well informed about tummy tuck procedures or body contouring. And so that's the first goal. The second goal, or the second purpose of the video, is to fulfill a legal requirement that I provide you with what's called informed consent. Informed consent means that I provide every patient who's contemplating having a surgical procedure with the risk and limitations and alternatives to that procedure, so that as you consider whether or not to have that procedure, you're aware of those things. You would have been given a clipboard that has a couple of things on it when you were brought back to view the video. And the first thing is a checklist. And on that checklist is, in order of the list that you'll be seeing and you'll be hearing me talking about, you'll have an item listed that will have a blank out beside it. And once you've heard that and you understand what I've said, I want you to initial that. Don't check it, initial it. That way I know and you know you've heard about that and you understand it. If you have further questions about a specific area or whatever, don't do that. Leave that one blank. And during our face-to-face consult in a few minutes, I'll make sure we go over that and fully explain that to you so we satisfy that. The other thing you will have been given is a biographical sheet on me that explains my education and training and my board certifications and my hospital privileges, as well as academic appointments. And I want you to know my background. I think it's important to know about your surgeon before you consider surgery. So once you've read that and reviewed that, there's a little space about 2/3 of the way down the sheet that says for you to acknowledge that you understand that and initial there also. So I think those are a couple important things. Tummy tuck procedures have changed significantly over the last years. Instead of what was done from about 1950 really up until for the next 50 years, which was the old conventional traditional tummy tuck, the newer approach is called a lipoabdominoplasty and has been developed to avoid some of the downsides of the earlier procedures. The early procedure, the traditional conventional tummy tuck, basically involved an incision made as long as needed, and all of the skin and underlying fat was lifted off the muscle all the way up to the ribs, all the way across. Now, that worked well in most cases. And it worked well until the 1980s when liposuction came along, and then all of a sudden people started doing that same procedure as well as doing liposuction beforehand, and complications started popping up right and left. I mean, there were a lot of complications there for a little while. And the reason was when you lift the skin and fat off the muscle, you're cutting the little arteries that come from the muscle that go up to the skin that feed the skin. And so if you combine that with liposuction, sometimes people didn't heal very well and had significant healing problems. And so several years ago, a modification of the procedure was developed that avoids that. And the lipoabdominoplasty not only does not avoid liposuction during tummy tuck, it's a critical part of our newer tummy tuck. And so the procedure involves doing liposuction of the entire midsection, which I believe is a significant advantage in the patients who need liposuction. And I would say 90% of my patients need some liposuction. I do see some skinny patients who don't, but most patients need some contouring. But the liposuction itself loosens up the tissue. And not only does it contour and reduce the volume and the size and give you a waistline that's better and so forth, but it loosens the tissue up. And so instead of, with the newer approach, instead of lifting up the entire skin and underlying fat all the way over, the only part that's actually lifted up off the muscles is the central part in an upside down V that allows you access to the muscle edges in case there needs to be some muscle tightening. And that's the only part that's actually lifted up. So all of the remaining little arteries coming up from the muscle are still there. They're still intact and they're still feeding the skin. So the blood supply remains good and the healing, I think, is faster. I used to say about the recovery was about 3 weeks to get back to activities, and now I say it's closer to 2 weeks. And I think it's simply because there's less of that business about lifting tissue up off the muscle, so there's less space under there to heal. All in all, I've noticed a better result. I think the contouring in the midsection is better. Patients seem happier, and I think I'm able to overall give patients a much better, I guess, what I'd call a value for what they're going through, which I think what most people really would like. So that's really what I've been doing for quite a few years, and I've even modified that over time, and it's certainly been a big improvement. The mini lipoabdominoplasty is something I'm going to touch on for a minute, and I want to explain some differences here. And what most people really want for financial or recovery or other reasons is they want maxi results with mini surgery. Well, I mean, who doesn't? I mean, that's what I think everybody would like. You do very little surgery and get maxi results. But here's the thing. Some people really can get by and do extremely well with a mini tummy tuck. And so what that involves is still doing the same body contouring with liposuction around the midsection. But in those patients who do not have a tremendous amount of excess skin, particularly above the belly button, then a mini tuck can be done where the lower half of the skin between the belly button and the pubic line is removed. Now, if you really think about it, it's not very much skin. It's couple of inches, at most. And so, but in some patients, they have mostly fat and a little bit extra skin and nothing above the belly button that's very loose, so they can get by pretty well with doing a mini lipoabdominoplasty. However, I'm going to say that, and I've not really taken this to paper and figured it out, but I would guess that only about 5% of patients really fit in that category. Most patients, particularly after babies or weight gain and weight loss or both, basically have excess skin both above and below the belly button and have too much skin to get what's a reasonably good result with a mini tuck. And the downside of doing a mini tuck in a patient who has that extra skin is you burn bridges, because you've already removed half that skin there between the belly button and the pubic line. It's very difficult then to go back and then do the upper part because it's hard to close. It's you're burning bridges. So most patients really qualify for a full lipoabdominoplasty. And during the full lipoabdominoplasty, it's the same sequence basically. Full liposuction is done from the breast fold to the pubic line, all the way around, including the area under your bra, love handle area, upper hip and flank, all the way around to the back. So there's a complete liposuction done. And that's followed by excising usually all of the skin between the belly button and the pubic line. So sometimes it's a height of skin that's that tall, and the width of the skin can be that wide. It's quite a lot of skin, but that's variable depending on the patient. The length of the incision is not determined by the surgeon. It's determined by how much excess skin you've got. So if you sit on the edge of a chair and look down and you see you've got a fold of skin there that sort of hangs over, and you look out to the side and see how far out to the side that fold goes, that's how far your incision needs to go if you're going to get that extra skin that's hanging above that's creating that fold. So you can't make a short incision and expect to get skin off that's excess out to the side. So really you determine the length of the incision instead of me. And so the key to a happy patient, though, is making an incision that's easy to hide in terms of the scar. Now, if you get on the computer and you look at some results from tummy tucks, you're going to see a wide variety. And the worst ones are the ones that look like a smile that go way up on the side like this. There's not any bathing suit, particularly two-piece bathing suit, or any nice panties that will cover that. Even granny panties sometimes don't cover it. So that is not a scar that anybody's very happy with. And so it takes a little extra effort and time, but what I like to do is I like to keep the scar hidden and low so that a normal width of band of underwear or bathing suit to the side can cover the scar. So hopefully, if you want to wear a two-piece bathing suit, or you want to wear some cute panties from wherever, you can do that, and do that in a way that'll cover your scar. So keeping a low scar that's well hidden, I think, is key to, in a lot of cases, key to a happy patient. The muscles are treated probably in 2/3 or 3/4 of the patients. And basically what I mean is after pregnancies, there's a lot of stretching. Obviously, everything stretches. There are strap muscles that go down on each side of the belly button called the rectus abdominis muscles, and they're connected together with what's called connective tissue. And as you go through 40 weeks of pregnancy, that stretches out and apart. And so the muscles can get back in good shape, but unfortunately that tissue that holds these muscles together does not. And so in many cases, to get a flat abdomen, those muscles are sutured together toward the midline to tighten that area and to get a nicer, flatter result. That results in a little bit more discomfort because of the suturing in the muscles, but it's worth it in terms of the result. And I would say a lot of people have that done if I feel at all that it's going to improve your result. I think it's important also to talk about how do you choose. I mentioned a mini lipoabdominoplasty versus a full lipoabdominoplasty. As I've gotten more gray hair and I've done a lot of these procedures over the years, I've gotten a little bit more, I guess, either stubborn or realistic about how I approach that. I will only do a mini abdominoplasty or a mini lipoabdominoplasty on a patient I feel is a good candidate for it. I won't do it just because a patient thinks that's what they want instead of a full. If a patient needs a full lipoabdominoplasty, I won't agree to do a mini. I can tell you there are people in this region, if you'll sign the check, they'll do whatever you want them to do, but I'm not going to do that. I'm only going to do what I think is going to take to make you happy and look good and be a good representative of someone who I've done who's had a good result. So I'm not, on the other hand, I'm at a stage in life where I don't have to operate to be happy and don't have to work to live. And so it's not my goal to sell you a procedure necessarily, but I'm only going to do the things I know for sure are going to make you happy and end up with a good result. So the process of having this procedure, should you decide to do it, is, let's say you decided to do it on a Monday, you would come in. Now, a lipoabdominoplasty is a longer procedure. It's a 4-hour procedure. And so you'd come in, you get here about 7, you'd be given some sedation, you'd be in the holding room, an IV is started, your vital signs, blood pressure and so forth are taken. The certified anesthesia provider interviews you and goes over your health history and so forth to determine your suitability for anesthesia. And then you're taken back to the operating room after you're marked. Now, in a standing position, we mark for both the liposuction part and the abdominoplasty part. And then after that, you're taken back to the operating room and you're given anesthesia. Once you're asleep, the areas to be liposuctioned are then injected with what's called a tumescent solution. And that tumescent solution is a mixture of local anesthetic that numbs up the area to be operated on, plus some adrenaline or epinephrine. And what that does, it constricts blood vessels and limits blood loss with the liposuction part of the procedure. Usually there's a gallon of that put in or more. So there's a lot of that fluid injected into the fatty areas, in order to get anesthesia to the areas as well as limit any blood loss there might be. After that, I give the patient at least 10 minutes or 15 minutes for that epinephrine to work to constrict the blood vessels. And then the first thing I do then is the liposuction. That, depending on the patient and how much volume of fat there is and so forth, that can take an hour or hour and a half. I mean, it just depends. But I finish the liposuction in the midsection. That's the first thing. Then the patient is prepped and draped all over again, and with full sterile technique, the abdominoplasty part starts. That can take 2.5 or 3 hours, depending on the patient, depending on how much skin there is, depending on how much muscle work that needs to be done. My basic philosophy on this is I think there are 2 speeds when you do surgery. You can do it fast or you can do it good. And so I think in general, I just take the time it takes and use the number of sutures, the deep sutures it takes to get a good result. By the end of 4 hours, patients are then awakened, taken to the recovery room where they're watched by an experienced recovery room nurse. And like any outpatient setting, they're kept until they're alert enough to be taken out as an outpatient by a friend or family member and so forth. 2/3 of my practice is from out of this area, so a lot of our patients stay in town the night of surgery. Other patients who live reasonably close can go home and sleep in their own bed. There'll be a lot of information provided to you about this, all of the details about this, should you decide to schedule. The alternatives to doing a tummy tuck or liposuction, basically are weight loss and exercise. A lot of our patients have already tried that and it doesn't work. Either that or they don't do it very well. So, I guess being realistic, you see such a wide variety. But the alternative really to any cosmetic surgery, I think, is just don't do it because it's not a life-saving thing. As we move forward, I want to talk about the risk and side effects and so forth of these procedures. The first is discomfort. When you have this tight closure of the abdomen, and particularly if the muscles are tightened together, there's naturally some discomfort. And patients for a few days walk around a little bent over. In fact, the first 2 or 3 days, I like people to sleep with pillows under their knees to flex their knees up toward the chest. It takes the tension off the abdomen. Sometimes we have people use heating pads. There are a number of things we do that are on an individual basis. But there is discomfort with this. Some people tolerate it better than others, which just basically means some people have a different pain threshold than other people. But we use pain medication adequate to keep people comfortable, and most of our patients do very well with that. When you lift the skin up, you are cutting through a lot of small thread-like sensory nerve endings, and so there's numbness of the lower abdomen. Some of you have had C-sections and are still numb years after that. So any abdominal surgery can leave areas of numbness that can be temporary or permanent. Abnormal scarring is seen occasionally. It's not a very common thing. We try our best not to close it in such a degree of tightness that it will automatically cause scarring. But some people scar differently than others. Some people require some treatment later on for abnormal scarring. And that can involve something as reasonably simple as injecting some cortisone into the scar to soften it up and shrink it down, to, after 6 months or longer, doing a scar revision to improve it. Infections are extremely rare with these procedures. In 30 years, I really can't think of any real significant infections. I've seen infected stitches, but I've not seen many infections, really. One complication that occasionally happens is called a hematoma. Now, when we're doing the surgery, and particularly by the end of the surgery, if there's any bleeding points, if there are blood vessels that are oozing, we control those. And I don't close a wound with their active bleeding going on. That just doesn't happen. But occasionally, when, let's say, an artery's in spasm during the surgery and will relax and bleed after a few hours, there can be some bleeding that starts later on that can cause a collection of blood. Collection of blood is something that, if it happens, has to be drained, and that's one of the reasons some people need a return visit to the OR. Usually it's within a day or two, but that requires a little bit more anesthesia, long enough to evacuate the collection of blood and take care of it. And we cauterize any bleeding points and so forth. So it is something that occasionally happens, but it's pretty rare. It's been several years since I've seen a real hematoma after an abdominoplasty of any sort. A seroma is a collection of body fluid or serum. And the national average for seromas after a tummy tuck is about 10%. And I think in my practice that's probably about what I see. I use drains on every patient. And there are 2 drains that are placed with a tummy tuck that come out the pubic area. And they're a little bit less around than a pencil, so they're not great big. And the purpose of that is to suction out any drainage that tends to accumulate in that space. Even when you leave those in long enough that there's minimal drainage and there's an indication to remove the drain, some patients will still collect a little bit of serum. And if that happens, it's not hard to detect. And most cases are treated with simple aspiration with a needle. Sometimes it takes 1 or 2 or even 3 sessions to aspirate that, but it usually settles down and stops draining, and I don't see that being a prolonged problem, really. By definition, a tummy tuck is closing the area very tightly. So with a tight closure, there's always a chance that some section of the wound might separate a little bit because there's a lot of tension across that wound edge. If that happens, we treat it. Sometimes it heals in primarily, just secondarily. Sometimes I have to put a suture in it, but that occasionally happens. Skin loss means that for some small or larger area, some portion of the skin dies. And if that happens, then it has to heal in, or you have to revise it or close it. There are a number of ways that you deal with that. That is seen primarily in people who smoke or have or use other forms of nicotine. It's well known that smokers have about a 17 times higher incidence of healing problems than non-smokers. So we have a nicotine policy that we follow pretty strictly. In the patients that smoke, we ask that they be off all forms of nicotine. And I mean everything from vaping to cigars to pipes to cigarettes to Nicorette gum to patches, doesn't matter. Any form of nicotine I want patients off of for 6 weeks before surgery. Now the way we monitor that, in the past we didn't really have any good way to monitor that, but now there's some excellent tests available to test for nicotine. And some of them are so sensitive that they pick up for about 3 weeks. So the way we manage this, and we're not just picking on smokers, we just do this in general, is at your 3-week preoperative conference, so 3 weeks before surgery, you'll have a test for nicotine. If you test positive, we won't keep you on the schedule. So we won't do your surgery if you're positive for nicotine. So if you're negative at your 3-week pre-op conference, it means to us you've already been off 3 weeks from all forms of nicotine. Then the day of surgery, we do a second nicotine test. If that's negative, obviously we proceed with surgery. You have eliminated, by staying off nicotine for 6 weeks, you've eliminated 80 to 90% of the risk associated with nicotine. If you test positive, we'll cancel your surgery. We've done it before and we'll do it again, I'm sure. I won't operate on somebody for an elective procedure with nicotine on board, knowing it can cause such severe problems. So that's something you really need to think about if you're a smoker or if you use nicotine as you go forward in trying to decide what you're going to do. Injury to deep structures is something that I've never had in my practice. I've never seen, never want to see, but is reported in the literature. With liposuction, sometimes people who, particularly novice surgeons, can perforate into the abdominal cavity, and there have been all kinds of organs perforated and intestines perforated, which obviously can cause all kinds of severe problems. I've never seen that, never had it, don't intend to start now. One of the things that's critical when you're talking about a tummy tuck and with liposuction is the issue of deep vein thrombosis, which is clotting in the veins of the calf, which can then progress up the leg. Clots can break off and go to the lungs and kill you. So that is a severe medical complication that you really want to try to avoid at all costs. The things that we do during surgery is, number one, we don't operate on people with a body mass index above 30 because the risk goes way up from there. Secondly, during surgery, we use sequential compression devices that are continually massaging the calves and the thighs to ensure good blood flow and there's no stagnation of blood in the veins of the legs. Thirdly, we want people to ambulate early. This is not a procedure we want people to stay at bed rest on. We want people up and about. We want you going to the bathroom on your own, even the night of surgery. Starting the next day, I want you walking. I want you walking several times a day. You don't have to set any records, but I want you walking because the muscle pump in the calves can really help prevent that complication. And I can knock on wood or sawdust and tell you that in 30 years I've never had one of those, and like I said before, I don't really intend to start now. So as you gather, we really put a lot of emphasis on the body mass index. And that's basically something that's calculated between your height and your weight. And again, you can look that up online and you can calculate your own body mass index. We have charts here that we use, but when you have a body mass index of above 30, we're very hesitant to do surgery. Other complications can include surface irregularities where there's more liposuction removed from one spot than the other that might require minor revision later. There can be an altered appearance of the belly button. Well, that's not surprising because as I talk to you in the consultation room in a minute, I'll show you kind of what we do with the belly button. A lot of the patients that need a tummy tuck haven't even seen their belly button in years, and so obviously it's going to look different. And so hopefully it looks acceptable and even preferably better than it started, but there's no question that there'll be some alteration in the appearance of the belly button, hopefully to the better. Dog ears are heaping up of the end of the incision. I don't see a lot of those, but they're not a severe problem. If people have what we call dog ears or fullness at the end of the incision, after 6 months in the minor surgery room, I'll just take care of those, and there's no charge for that. It's just something that you do if you need to. Because there are medical complications that can occur with this procedure, delayed healing situations and so forth, there can be a delay returning to work. You need to understand that. I don't know how you allow for it. I don't know how anybody really allows for that, but it's something you need to understand that, like everything in life, there aren't any guarantees, and certainly we'll do everything we can do to minimize complications, but some of these things could cause a delay of you returning to your work activities. There can be severe unexpected medical complications. Rarely people have reactions to anesthetic agents or have other issues. Those things can even have heart issues or other things, and so those rarely happen. I've been very fortunate and blessed that those have been very minimal, but they can lead to more debility and hospitalization and so forth, but it is something that's really extremely rare. Death after a lipoabdominoplasty has been reported. It's such a low percentage or low number that it's hard to give you any numbers. I don't think it's even as high as the 1 in 50,000 that's been quoted in the past. I think that was back when people weren't very careful with liposuction and so forth. But it is something that with any surgical procedure is a possibility. And most people don't, especially surgeons, don't like to talk about it very much, but I think it's just part of the informed consent process that people understand that there might be some tiny risk of that out there. In discussing financial policies, there are a couple of things I want to go over with you. Included in the fee for your procedure is the surgery center, all the overhead staff expenses and so forth, the expenses of doing the surgery, supplies, anesthetic supplies, and so forth. It also includes the fee that I pay the certified anesthesia provider for your day of surgery, and the surgery fee. It also includes your post-operative visits. It does not include your pain medications and antibiotics, but we use generic things pretty much, and so they're not terribly expensive. We have here what we call a 2-week global. Anything that happens to you that requires a return to the operating room within 2 weeks of your procedure, there's no additional charge. It's included in your initial fee. I would challenge you to check with any local hospital or any surgery center and ask them if they would do that. And the answer is obviously no, but we feel that's a fair way to treat our patients. And I'm really able to do that because I don't take many people back to surgery within 2 weeks of surgery, so it's something I think I can do. For minor touch-ups, like I mentioned before, like for dog ears or little areas of extra fat that I need to reduce a little bit more, those are done in the minor surgery room at minimal or no charge under oral sedation and local anesthesia. revisions that are larger that require return to the operating room, basically there'll be no surgery fee for those, and any fee would just be to cover overhead costs and pay the anesthesia provider. We do have financing plans that are available that will allow you to make payments over up to a 5-year period that make it very affordable, and that depends entirely on your credit rating that's determined by the company. We use a company called Care Credit that is a subsidiary of GE, and they determine all that business about your credit rating and so forth to quote you an interest rate and so forth. So I hope I've answered a lot of your questions maybe you came in with and given you information you need to make an informed decision. As you go over the form you have there, just make sure that if you understand all the things I've talked about that's listed there, that you've initialed out beside that. If you don't understand it or you have a question about it, don't initial it, but write your questions down below, or any additional questions you have, because I want to make sure when you leave here, you feel totally comfortable that I've answered all your questions and that you feel well informed about this possibility of this procedure. I'll be seeing you in a few minutes in the consult room in person and meeting face to face and spending more time with you. So now that we're through with this part, just take your clipboard and your forms back out to the staff and they'll take you over to the consult room. Thanks for listening.